Hello everyone, I am Dr. Parvez Ahmad. Today I am going to talk about the emetics. Tell me what the mean by emetics? Okay, before starting the emetics, first to understand the vomiting. Okay, vomiting occurs due to the stimulation of vomiting center. Okay, which are located in the medulla oblongata, and multiple pathways involved in vomiting, especially CTZ and NTS. Okay, we know that in CTZ and NTS different type of the receptor are present, like dopamine D2 receptor, 5-HT3 receptor, histamine that is H1 receptor, and neurokinin receptor. These receptors present in CTZ and NTS. A stimulation of this receptor lead to the vomiting. Okay. Now here today we have talked about the emetics. That means the drugs which provoke the vomiting, that is called emetics. Okay. Now where we prescribe such type of the drugs, especially we are prescribed in case of undesirable substance is ingested or poisonous substance ingested. In that case we have use emetics to induce the vomiting. Okay, that means the vomiting inducer drugs is called emetics. Okay, nowadays two types of the drugs nowadays available in a market to use as a emetics. First one is called act on CTZ. Example is apomorphine. Basically, apomorphine is a semi-synthetic derivative of morphine. It acts by stimulation of dopaminergic receptor in the CTZ. Okay, and especially apomorphine take the 5 minutes or less than 5 minutes, we can say within the 5 minutes it start their actions. Especially we have used at the dose of 6 milligram, either subcutaneous or intramuscular. Okay, generally apomorphine not you have preferred in case of the children or elderly patient, because apomorphine may cause respiratory depressions. Okay, that's why not preferred in children and elderly patients. Okay, now second category of emetics are called reflexly and act on CTZ. And this category single drug Ipecac. Example is Ipecac. And full form is Ipecacuanha. Okay, basically these are drugs we have obtained from dried root of a plant is called Cephalis Ipecacuanha. Okay, and these are drug is safe in case of the elderly patient as well as the children. And nowadays their syrup dosage form are available from the 15 to 13 ml to induce the vomiting. Okay, now how does it work? Ipecac basically directly irritate the mucosa and stimulate the CTZ. That means that these are act by two ways. In some condition, these emetics are contraindicated, like in case of kerosene poisoning, or contraindication of emetics. First one, in case of kerosene or petroleum poisoning. Okay, because chances of the perforation. Now next contraindication in case of CNS stimulant drug like amphetamine, CNS stimulant drug poisoning, amphetamine poisoning. Poisoning, okay. May chances of convulsion, that's why not use. Also, emetics is contraindicated in case of unconscious patient, because in unconscious patient laryngeal reflex are likely to be impaired and chances to aspiration, that's why not use. Now in case of acid base poisoning, also emetics is contraindicated. So this is all about the emetics. Thank you.